Hello and welcome for another session of AMD Info Bites. My name is Andrew Browne and I'm one of the retina specialists here at the Gavin Herbert Eye Institute. One of the questions that we are frequently asked is in relation to how frequently and for how long people will need to have injections for wet age-related macular degeneration. Fortunately, we do live in a time when we have injections which can try and control the disease of wet macular degeneration. Rather than thinking, how long specifically will I receive injections, or how many injections will I receive, it's better to probably think about how active is the disease process. When the disease is active, it will need to be treated. When wet macular degeneration is not active, it can be observed. Regardless of whether it's active or inactive, patients should always continue to be monitored closely and have visits with their ophthalmologists. People who have wet macular degeneration can be treated and enter a period of what one might consider remission or low activity of the disease. The disease may actually remain inactive indefinitely. That is not always the case. So whenever people have wet macular degeneration, if it is a very active disease process, you will need many and more frequent injections. As the wet macular degenerative process becomes better controlled, fewer injections are required. And ultimately, one might be able to get the disease to become inactive or quiescent, and then it can be monitored for relapses or recurrence of disease activity. Again, my name is Andrew Browne at the Gavin Herbert Eye Institute. Thank you for joining us again for another AMD Info Bite. If you have any specific questions, please consult your ophthalmologist or your primary care doctor.